Come in.
Hi, Adrian. I'll be your nursing student today. Can you please tell me your name and date of birth?
As woman, October 2nd, 2006.
Okay. We're going to be performing a head, neck, and lymphatic assessment on you, if that's okay.
Yes.
I'll wash my hands. Okay, and first I'm going to inspect the skull, noting the shape and inspecting for any deformities or lumps. Okay, everything looks good. Okay, and now I'm going to palpate your sinuses. So I'm going to palpate your frontal sinuses. I'm going to palpate your maxillary, your temporal artery, and your temporal mandibular joint. Now I'm going to check and make sure that your trachea is midline. Okay. And I'm going to palpate your carotid arteries using the right technique. Right, and now I am going to have you perform some range of motion for me. So I'm going to have you look up and down. Okay, I'm going to have you look from side to side. Perfect. Alright, and now I am going to palpate your lymph nodes. So you're going to palpate the preauricular, postauricular, the submental, submandibular, okay, and then the posterior cervical, and the superficial cervical. Okay, and then I'm going to have you turn your head to the right. And I'm going to feel for the deep. I'm going to palpate the deep cervical chain. Okay, and you look back at me. And I'm going to have you shrug your shoulders. And I'm going to feel for the supraclavicular lymph nodes. Okay, everything looks good there. And now I'm going to have you perform some range of motion with some resistance. So I'm going to have you look to the side against my hand. Other way. Okay, and place my hands on your shoulders and I'll have you shrug your shoulders. Okay, perfect. And now I'm going to come behind you, right here.
Sorry.
And I'm going to have you look to the right. Okay. And then I'm going to palpate your thyroid gland. So I'm going to have you Okay, I'm going to have you swallow for me. Okay, perfect. Come back this way.
So sorry. You're fine.
Okay, and now I am going to wash my hands and document.